Bolivia is a land of history and tradition. Its lands, valleys, and lakes have been witness to the birth of a number of great cultures. Currently, 65% of the Bolivian population belongs to or is descended from the Aymara, Quechua, Chicha, or other indigenous groups. This heritage has had a profound influence on the mentality of this country. In the department of Potosi, there is a province called Sud-Chichas, a pleasant farming valley. Its capital, Tupiza, is considered one of the country's most appealing cities. The Chicha Indians, who are native to the region, have their own traditions and characteristics, which have been preserved to this day. The coexistence of the Catholic religion, which predominates in the region, creates an interesting cultural diversity. But the extraordinary beauty of the countryside and the intensely blue sky sometimes tend to mask the other reality. This is one of the poorest and most depressed areas in Bolivia, which is facing a severe economic and social crisis. The region has high rates of infectious and contagious diseases, which are the result of poor living conditions and low levels of socioeconomic development. Children and women of childbearing age are the groups that are most vulnerable and suffer the most from these conditions. In 1991, the Pan American Health Organization, with financing from the government of France, launched an intensive cooperation project in this province aimed at strengthening the health districts of the Tupiza Health Unit and improving health services in the region as a whole. The Tupiza Health Unit covers an area of about 42,110 kilometers. Within this large territory, health workers confront many challenges. 60% of the population of this region is infected with chagas disease. The incidence of tuberculosis is high among adults. Cases of cholera exist due to the lack of safe drinking water. And respiratory infections and gastrointestinal diseases associated with poor diet and nutritional status are among the leading causes of infant mortality. All these diseases are diseases of poverty. In response to the social crisis that the country is experiencing, the Bolivian government is seeking to promote joint action by all social groups in order to address the situation. The law on popular participation, enacted on the 20th of April, 1994, aims primarily to involve indigenous, rural, and urban communities in the political, legal, and economic life of the country and ensure a better quality of life for Bolivian men and women, with a more equitable distribution and better administration of public resources. This legislation was another in a series of measures designed to increase the involvement of the community in the identification and solution of its problems.
The municipal government is working among the people to raise awareness and encourage use of our services. In the area of health, we have a high level of involvement, and with the popular participation law, the people are the #1 factor in the implementation, strengthening, and development of activities. We are building a good level of support because people are more aware now. I think we needed the participation law to make people more aware of their responsibility for their actions.
Health authorities understand that implementing this new approach will take time and that to reach every community, every child, every mother, it will be necessary to change both the way in which healthcare is provided to patients and the mentality of health officials and the community members themselves.
Under these circumstances, the model is changing. We are going to supply health services through a model designed to deliver health care to families in their own environment. This is not paternalistic, medicalized health care, but rather care that stresses education. We emphasize the need for people to go to the health services, but at the same time, we offer them health education and health promotion activities.
Training and development of human resources is essential for this new model. Nurses and nursing auxiliaries are the personnel who are in constant direct contact with the communities. Courses and workshops are being developed to introduce approaches to working with the community that are in accord with the new healthcare model. The participants themselves will then hold similar workshops in their respective districts, so that, together with grassroots organizations, they can identify the problems of their communities and prioritize their needs.
The health sector is trying to get closer to the community to gain firsthand knowledge of the issues of concern to the population in order to be able to intervene more effectively. Not the way it was until recently, when all health sector activities occurred in an institutional framework with no outreach to the community.
Going into the community has created new challenges for the health sector. It has meant reaching a new level of communication with the people and learning about their problems. Above all, in this process of decentralization, it has meant taking more direct responsibility for programs and for the objectives established. It is the Regional Secretariat of Health that manages the various programs. Unfortunately, chagas disease is a fact of life for the people of the region. More than 60% have the disease. The Chagas disease program was designed to address this situation and has brought many benefits to the communities. The program, which was launched in 1987 and is currently in its final phase, is composed of various sub-programs which are carried out simultaneously. The kissing bug, as it is commonly called, is studied in the laboratory to determine its degree of infectiousness. Every community has been visited to conduct blood and heart tests on every person. Data were thus obtained on the insects and on the infected population. This information is essential for keeping accurate statistical records and developing an epidemiological profile of the disease. In the field, visits are made to communities to locate households that are infested with kissing bugs and to establish contact with community members and make them aware of the importance of taking the necessary measures to control the insect. The improvement of housing, chicken coops, and animal corrals is very important because the bugs live and reproduce in cracks in walls and hollow cane. International aid has been vital in this phase.
We have improved housing through the PMA project. This is a food aid project. We have used food to motivate people. Why? Well, that's because when farmers are spending their time working on their houses, no one is bringing home any money to feed the family. That is why we designed this program that gives them food in exchange for their work.
Housing improvements are complemented by insect spraying and annual inspections. If any bugs are found, the dwelling is sprayed again. Epidemiological surveillance committees have been created to detect any outbreaks of the insect. In this way, both effective control of the disease and sustainability of the progress achieved are ensured. Education has been an essential factor in the program's success.
Identifying a problem and teaching them about it in an objective manner is a little difficult in the case of country people. But when we go there and we take audiovisual aids and when we show them the stages of Chagas disease and how they can improve their houses and how community participation works, then they are motivated and they respond better.
The shortage or total lack of safe drinking water is a serious problem in this area. Latrines have been constructed, and health workers give frequent talks in the community to educate the people about environmental sanitation. In the community of Ramadas, for example, this nursing auxiliary works directly with the community and the Mothers Club, giving talks about how to prevent cholera and other diseases. Together, the intensive cooperation project that PAHO and WHO is carrying out with French financing and the law on popular participation are giving the health sector tremendous impetus and support. An example of this is the remodeling of the Tupiza Health Center.
This new infrastructure only exists thanks to the Pan American Health Organization, the World Health Organization, and the collaboration of the French government. This center here was founded in 1945. Before, we had only very small rooms that didn't really offer all the amenities for the personnel who work here.
The physical improvements have been accompanied by improvements in the delivery of services and preventive care for patients, including vaccination, monitoring of weight and height, and general medical care, as well as oral health care and extraction of teeth. As a result, more patients are now visiting the center. This social worker has heard that a baby is seriously ill. The community immediately makes available a vehicle so that she can travel the long distance to where the baby lives. After examining the baby, she realizes that he is suffering from serious respiratory problems. It is vital to take him to the health center where he can receive better care. The baby's father is not home, and the mother refuses to take the child to the center without his approval. If the child dies at home, it will be the mother's fault. If the child dies in the hospital, it will be the doctor's fault. The dilemma for this mother is not just that her child's life is at stake, but the reprisals that she may suffer at the hands of her husband. 3 days later, the baby dies at home, without having had the opportunity to receive good medical care. In the mind of this Andean man, Western medicine often has no place in his life or is at the most a last resort to alleviate his suffering. The health sector understands that providing health care in Bolivia means incorporating traditional medicine, ancestral practices that cannot be eradicated and so must be incorporated and put to good use in the healthcare model. Workshops on the subject have been organized, and in some regions of Bolivia, traditional preventive medicine centers already exist. In Bolivia, it is said that a good birth will produce a good man and a good Bolivian. Many Bolivian babies are delivered by traditional birth attendants. Workshops have been organized to improve this practice. These birth attendants are being given new knowledge and taught new methods in order to reduce the risk to both mother and baby during childbirth. In this region, both agriculture and livestock raising are basically subsistence activities. The products derived from these activities are limited and do not ensure a complete diet or sufficient income to have access to balanced nutrition. Even worse, if an Andean man gets sick, he is unable to farm and cannot provide what his family needs. In this region, every workday counts. These men will exhaust all their physical resources before they seek help. Nursing auxiliaries, consultants, community leaders, and social workers are all working together to ensure that the cycle is completed. A good birth, a good man, a healthy Bolivian. Healthcare programs for mothers and children have been very well received in the community. With ongoing education, cases of cholera are occurring less and less often. While chagas disease can't be eradicated due to the nature of the infection, it is now well controlled.
We are quite hopeful that we will be able to have a big impact in the region. We are very enthusiastic about the work we are doing here and what we are starting to accomplish. We are making progress and developing, and we are confident that very soon we will start to see results.
The Tupiza Health Unit has embarked on a process of improving its health services and making them more responsive to the reality in the region. The success of this process, which began in 1991, has been possible thanks to the determination and dedication of all who believe that health is not a privilege, but a basic right of all, and an integral part of sustainable human development.